Hello, everyone. Good morning, good afternoon, and good evening across the world. And welcome to this fantastic webinar that we have today, where we are talking about the role of nurses in research and rehabilitation, putting a spotlight on evidence and impact. It really is an amazing webinar that we have today. We've got amazing speakers that we have with us today, and who will be sharing their experiences and their stories in being able to highlight on the role of nurses in research and rehabilitation. My name is Menashe Nyika. I'm a young nurse from Harare in Zimbabwe, and I am also part of the Nursing Now Challenge Advisory Board and the co-chair of the Challenges Committee. And today I will be moderating this session together with my co-moderator, who is Dr. Mark Oram. He is the NIHR Global Recharge Research Manager with the University of Leicester. Mark, great to have you with us today.
Thank you, Menashe. It's great to be sharing this webinar with you, and thanks again for the Nursing Now Challenge for coordinating this. It's really exciting, and I can already see a huge number of attendees, so I'm really looking forward to what this webinar will offer everybody. So just to give a little bit more background to myself, so I am not a nurse, but I've had the pleasure of working with a number of nursing teams over the last 8 years during my PhD and also as a postdoctoral researcher. So as Menashe said, I'm the research manager for the NIHR Global Recharge project. This project looks at the intervention called pulmonary rehabilitation in low and middle income countries. And specifically, we're working with partners in Uganda, Malawi, DRC, Sri Lanka, India, and Kyrgyzstan. It's a great pleasure to have some of those members of the team speaking at this webinar, as well as many of the esteemed colleagues and members of the Nursing Now Challenge. So throughout my career, the reason that we've connected with Nursing Now is that I've been very fortunate to work with a range of nurses, COPD specialist nurses, specialists in pulmonary rehabilitation, and research nurses, such as Michelle, who you'll hear from later on. And nurses really have taught me so many things. They've taught me all of the skills I really needed for my PhD data collection, and Michelle can vouch that that was no easy task, but it included taking blood, so phlebotomy, and also conducting spirometry. So really quite complex skills that I would have had no chance of developing without nurses. And since then, I've continued to work collaboratively with nurses and work on many research projects with them. And so I owe a lot to nurses. I owe everything to nurses, really. And it really excites me that we can have this webinar, and hopefully it will be a great platform for supporting nurses to get into research, to get into rehabilitation, and to do this globally. So it's a great privilege. Back over to you, Menashe. Thank you.
Thank you so much, Mark. And really, I think that's a great introduction to our webinar today, because research really is the cornerstone of healthcare. It's the cornerstone of education, it's the cornerstone of practice. And really to be able to have this webinar today, it's really amazing because we've got so many experts that we have on this call today that are going to be able to share and give us a lot of tidbits on their stories. So that's really amazing. I will start with our first, introducing our first speaker. And we're going to be talking about an introduction to global research nurses. And our first speaker will be Arantxa de la Hora. Gonzalo. She is the Global Research Nurses Coordinator and Clinical Research Specialist with the Global Health Network. Arantxa, it really is amazing to be able to have you on the call with us today, and looking forward to your presentation.
Hello, everyone. Can you see the screen well? Yeah, it's not partial as it shows. Brilliant. Thank you, Mnashe, and I hope you can all hear me well. Good morning, good afternoon, wherever you are. And my name is Arantxa de la Horra, and I coordinate the Global Research Nurses Hub at the Global Health Network. My background is I'm a nurse and a midwife, and I've worked in research and lots of years in clinical work as well. So it's very exciting for me to be part of this webinar. And I would like to thank Nursing Now Challenge for having this opportunity to introduce global research nurses. I will just spend a few minutes providing an overview of global research nurses, the Global Health Network, and the new and exciting opportunities that we've launched recently. Here at Global Research Nurses, we want to provide you all nurses and midwives, with the support, guidance, and the information needed to fulfill your role and enhance your career as a nurse or midwife involved in research. Because by getting involved in research, we all play a vital role in improving patient care. Global Research Nurses is a network created to build a community of practice by nurses and for nurses. And this community enables nurses and midwives to engage, learn, seek opportunities to work in health research, and ultimately develop and lead their own studies. This is a global community, but we do focus on low resource settings. And as I was saying, by getting involved in research, nurses play this vital role in improving patient care, because research is the only evidence-based method of deciding whether a new approach to care is better than current practice. Our belief is, and I feel very passionate about this, is we all nurses and midwives, we must as a profession be responsible for providing the evidence for our own nursing and midwifery practice, as well as understanding, interpreting, and assimilating all the relevant research from other disciplines. And to support this, Global Research Nurses offers, as you can see, this is an image of our front page in resources from templates to checklist, anything that you need for your next research project. We've got here an image of training opportunities. In our events sections, we've got a list of upcoming free webinars and workshops and conferences. The e-learning section offers a myriad of free e-learning and certified courses to provide research nurses with a how-to training on designing, planning, and reporting any health research studies. And you can follow us on Twitter to get instant notifications on upcoming events and research updates. Our handle is @GRNurses. And Global Research Nurses is led by regional faculty leads who are research nurses in Africa, Asia, and Latin America. These faculty leads organize research capacity strengthening activities, such as workshops, training programs, or skill sharing activities in the regions. At the moment, we have Ralwiki Ekesia in Nigeria, that is our lead for Africa, and we've got Joby George in India, that is our lead for Asia. And we are currently looking for a regional coordinator for global research nurses in the Latin American, Caribbean region. So any expressions of interest, please, there is an email at the end of the presentation, just get in touch. And Global Research Nurses is not alone. It's part of the big Global Health Network family that offers knowledge sharing hubs. You can see lots of tiles, such as maternal and child health, infectious diseases, non-communicable diseases, different research processes and methods. We also have another dimension of the Global Health Network is offering research tools, such as the professional membership scheme, the process map, or site
Hi,
finder.
Arantxa. Sorry to cut you. I think your screen is a little cut off.
Oh, okay. Let me just try this. I'm going to unplug. That's why I was.
Sure. Maybe
Can
you
you
can
see?
try to stop sharing it, then try reshare it again.
Okay, I will do that.
Okay.
Because yeah, I could see the screen. Let me just do that. Screen share, and then let's do that. And share, and how is it now?
Yes, perfect.
Good. Okay. So I could see, yeah, there was. So you've missed a bit of the things, but let's go with that. So as I was saying, we've got different research tools, and the tools include Site Finder, for example. That is a tool that helps any group leading a research group can find different sites, so it can increase the breadth of the research, and research sites can increase the number of research they support. So it makes them continue, so they cannot just. It helps them to support more sites, so they can continue with the research work for longer, not depending just on one project. Go. Let's see if it works. Sorry, I'm just maybe having. How do I go into the next one? Yeah, there we go. We also offer research tools. And research tools, we've got loads of tools from across the whole of the Global Health Network and external sites. You can find things here from tools, templates, web apps, databases, crowdsources initiatives, anything that you need for your project. And this could be organized, or you can find it based on different relevant to research themes or diseases, or by regions. And let's hope this one, yeah, it works. And also we've got our flagship training center that provides free certified courses, and many of them are translated in various languages, and they're all free to take for anyone. And as members of Global Research Nurses, all nurses and midwives can access all the resources across the Global Health Network. And now I'm going to talk about one of the most exciting activities that we've done recently. We recently launched the Global Research Nurses Palm Priming Awards. And we are very pleased to announce the winners. It's something we've already communicated the results to the winners, but it's not yet on the hub. But we offered £20,000 in funds for small palm priming grants for nursing and midwifery-led research projects relevant to low and middle income countries. And this could be used for 3 types of activities. It could be used for exchange visits, small research projects, or to host workshops. And here we've got our winners, that we had 183 applications from 35 countries. And we've got the winner of the Travel Award is from Brazil. It's an ICU nurse, and this is to conduct an antimicrobial collaboration project between the University of Sao Paulo and Glasgow to develop, to improve the research skills and facilitate the development of future collaborative projects. We've got the winner of the workshop awards is from the University of Amida in Cameroon, and the title is Acquiring Research Skills by Practicing Nurses in Cameroon. And the winner of the Research Project Award, that is from the Aga Khan University in Tanzania, and the project was a mixed methods formative study to improve perinatal mental health in Tanzania. And what we are trying to do with all these projects is to bring and to support nurses and midwives across the world to get engaged in research in different ways, because there is not just one set way of doing so. And we've got a new opportunity coming up soon. I hope in the screen you cannot see also the images. I don't know where I'm sharing now. So the new opportunity coming up in November is we are going to launch a new competition to fund a place in a course. It's a course about qualitative research methods. And what is special about this opportunity is not that we are just offering this, it's a virtual course, but also we are offering mentoring. So we've got a nurse and midwife from the University of Oxford that is going to be the mentor, and is going to support the winner to throughout their qualitative research project, to their write-up, submission to an international peer review journal, and also to submit this study that they are doing to a nursing of midwifery conference to present the work. So that's very exciting. It will be coming up sometime, maybe second week of November, we are planning, so watch the space. And how can you get involved? So you could get involved by joining Global Research Nurses. If you haven't done so, it's free. You can follow us on Twitter to receive notifications of courses, opportunities. You can contact us. That's the email that we've got here, nurses@theglobalhealthnetwork.org. And we would love to support any local training opportunities or hear about any initiatives from anyone. And just to finish, remember, nurses are the largest global healthcare profession. And by engaging in research, we all, nurses and midwives, will enhance our career and will bring evidence-based changes to the health outcomes to the communities that we live with, that we work in. So let's work together to make it happen. Thank you very much.
Thank you so much, Arantxa. And really, I think your message really highlights the essence of this webinar today. We need more nurses in research and engaging in research, and really appreciating the work that you're doing with the Global Research Nurses and the resources that are available to nurses in being able to get involved and be able to drive research within their communities. I will hand over next to our next speaker, who is going to give us our keynote speech for today. And it's Dr. Jimon Paniamakai. Dr. Jimon is the assistant professor for Sri Chitra Trinum, the Institute for Medical Sciences and Technology. I apologize for my pronunciation of that. If you can be able to correct me. And Dr. Jimon is going to be presenting on his journey so far and the importance of engaging the nursing community in research and data collection.
Thank you very much. I hope all of you can hear me. Distinguished participants, ladies and gentlemen, it's an honor for me to address you at this very important webinar. Let me first congratulate Nursing Now for organizing this webinar and thank them for allowing me to speak on research productivity and role of nurses in research, a topic which is close to my heart. Today, as requested by the organizers, let me share a few thoughts with you about what can be done to improve our research productivity and then share my personal story. Let me acknowledge that sometimes research is daunting and potentially discouraging for novice researchers in particular. Research is not easy or cheap. We often complain about the lack of time for doing research, about lack of research funds, and about the rejection of our research proposal. Ladies and gentlemen, I cannot think of immediate solutions to the above challenges, but believe that persistence pays off and that any form of rejection can be overcome as far as the adage, where there is a will, there is a way is concerned. I believe that there is always a way to overcome the challenges, and my example is probably an apt one in this context. Let me tell you about my story. I was born in a small village in Kerala. Kerala is the southernmost state in India. I hail from a humble background of agriculturist and grew up in a rural area with impoverished expectations. My initial desire was to serve in the Indian Air Force as a pilot. However, I was fascinated with science and technology and later wanted to develop a career that relies upon applied mathematics, science, and medicine. Finally, I decided to pursue a career in medical and health research. But the problem starts there. I was not a physician to start with, and that was my biggest challenge in the initial period, and an advantage as well. I'll tell you why it was an advantage. I graduated in nursing almost 2 decades ago and pursued a full-time research career immediately after my postgraduate training in public health. So that helped me to focus on public health, and the nursing background brought me into the health domain. And in my research career, which was spanning over 1.5 decades at the national level, I could develop a focus on a particular field that was in cardiovascular disease and diabetes epidemiology in India. I was fortunate to get involved in several large international national epidemiological studies, which include some of the prominent clinical trials in the cardiovascular domain, like the ADVANCE study, the STITCH trial, which is a surgical trial, an Umpire polypill trial, and several other epidemiological studies, quality improvement programs, disease registries in India. The nursing background helped me to get involved in this program and take a full-time position in this program, and after some time take leadership position as well. In between, I completed PhD degree in cardiovascular epidemiology from the Institute of Cardiovascular and Medical Sciences in University of Glasgow. I also got fellowship support from the Wellcome Trust in UK to support my PhD studies, and even after the PhD studies to support my postdoctoral fellowship, early career fellowship, intermediate fellowship, and now I'm a senior fellow of the Wellcome Trust. So all these fellowship helped me to achieve or establish an independent research career, and also move from independence to interdependence, where we know that these days research, we need support from many quarters. We need support from clinicians, we need support from social scientists, we need support from other fields of health as well. Otherwise, we wouldn't be able to serve the society as we otherwise expect to do. So my initial research projects have been aimed at filling the gap in the data sources, particularly related to the cardiovascular health and risk behaviors and states in India, especially talking about the social role of transitions, and by generating comparable data on risk factors of cardiovascular disease using standardized tools. Then I developed a keen interest in implementation and evaluation of complex public health interventions, specifically targeting reducing cardiovascular risk. So I was fortunate to be part of several studies. One of them was an intervention study in worksite settings in India. Later, this program has been recognized as one of the model to emulate in low and middle income countries by international organizations like World Heart Federation and World Economic Forum. So my journey from the implementation and evaluation of complex public health interventions continued. I started working in several other research programs, and one of the prominent programs was the Kerala Diabetes Prevention Project. Now we are working to scale up this diabetes prevention project in the states of Kerala and Tamil Nadu in India. I could take leadership in these positions, leadership in these projects, and then train over 15,000 peer leaders in India and scale up this program and reach up to almost 400,000 participants in Kerala through this program. So we were able to train a large number of nurses to provide structured lifestyle intervention model or implement this model in Kerala and in India. So one of my other area of interest is also to understand disease clustering or multimorbidity. So I'm currently working on developing novel models for multimorbidity, management of multimorbidity in primary care settings. My research acumen, or including the quantitative analytical skills, and with a specific focus, public health focus, and my strong background in nursing, and then the commitment to high ethical and professional standards, and also the flexibility in devising proactive responses to the changing health priorities that are prevalent in India, that helped me to go through this process and take leadership position in research in India. So how it had happened? It all because of my self-motivation. So you might have heard about the Stovall's theory of the art of productivity, which indicates that motivation is the most individualized and personalized human trait. Therefore, it is all up to us as an individual to determine what is the way that we need to choose, what is the most effective way to stay motivated. So in terms of research and publication, self-motivation is definitely required. We have to rise after we fall, dust ourselves off and start again. That is very important. Now, if I think about a metaphor, it would be something like the shower that we take every day. The shower that we took yesterday has worn off the body and you need to take another one. So that's the way that it is. And it has been shown that through research, those who are motivated scientists, those who have strong interest in their work, as a consequence of that, they are more productive researchers. So there is no other way, ladies and gentlemen. We need to get motivated. We need to be passionate about what we are doing, how we are serving our patient population, how we are serving our citizens of our respective country. And often we think that it is a fight or flight reaction. So the natural instinct for a reptile is a fight or a flight instinct, which tells the reptile to swiftly decide to either flee or fight when in a situation that threatens its life. It's the same situation for us as well. We face a lot of challenges in research, and we need to fight it out. We need to find alternative solutions based on the resources that are available in your own country, in your own settings, where you're working. So all that context matters. And then, ladies and gentlemen, let me urge you to individually and collectively re-examine our research productivity. As I say, productivity is a process that begins with defining our own success, establishing a mission, evaluating our own passion, creating motivation, and communicating appropriately. And we need to often think out of the box. There is no easy solution against. And often we need to go against the norm, and we need to say that investing in research is not waste of time. We all are engaged in clinical practice. Almost all of you are engaged in clinical practice, but it is still possible for you to get involved in research. It is still possible for you to take leadership roles in research. My parting words are that perseverance and hard work is the key to successful academic research. Without that, you wouldn't be able to achieve anything in research. I am personally looking forward to your success, and I am hopeful that and we get some Nobel laureates in medicine or physiology from the nursing community in the future. I encourage all of you, those who are serving the patient population, those who are serving the communities, to engage in research, take leadership roles, and then take our profession to higher standards. Thank you very much.
Thank you so much, Dr. Jimon. And I would just like to reiterate the message that you've just said, that we hope to get some Nobel laureates coming from nursing. And really just to share a message to our audience, if you've got any questions for any of our panelists today, if you can be able to put in your questions in the Q&A box, and we'll be able to get through to your questions in our question and answer segment. But just really to thank you so much, Dr. Jimon, for your very motivational speech and keynote. And it really is amazing to be able to hear about your journey in being able to hear about from where you began and all you've managed to do and achieve up to this point. And I think that really highlights what this webinar is about today, and that looking at being able to motivate and encourage nurses to get into research and to really highlight how research and having nurses part of research is really important. So really appreciating your keynote for today.
Thank you very much.
I would like to move on to our next session. And the session will be on experiences of nurses involved in rehabilitation research. For this session, we've got 3 panelists that will be joining us. We've got Camila Pereira. So Camila is from Katsu International University in Sri Lanka, and she will be sharing experiences of starting a distance learning PhD. Welcome, Camila.
Thank you. So I will share my screen. I hope you all can see my screen. Thank you.
Yes,
so
perfect.
hi everyone. I'm Chamila Pereira from Sri Lanka. So this is about actually how I'm experiencing my PhD as a distance learner with University of Leicester, as well as that the rehabilitation research as a nurse, how I'm involving with the rehabilitation research and how I'm experiencing it. So before moving for my experiences, I will just give an background on my basic background on myself. So I'm a nursing graduate from Sri Lanka. So as well as that, I have done my specialty masters in food and nutrition. And currently I'm working as a nursing educator and nursing lecturer in KIU with Katsu International University in Sri Lanka, which is one of the main private university for the nursing higher education. So so as you can see, we are involving with actually under our supervision, there are around 3,000 nurses who are doing their undergraduate degree, as well as that we are really involving with all the improvements of the research project, research knowledge in nurses in Sri Lanka. So with that case, that is just the nursing related things. So with this background, I have really got opportunity to join with the Global Recharge Project, which is one of the really changing point in my life. So with that point that I have joined with the NIHR Global Recharge Project as a part of the Sri Lanka Recharge Project. So with there that I have got opportunity to do my PhD with University of Leicester under the supervision of great supervision of Professor Sally Singh, Dr. Markomi, who are here today, and Professor Savitri Manasekara as my local supervisor. So with their guidance, I am doing my PhD currently in related to the development of the culturally appropriate pulmonary rehabilitation program for patients who are with COPD, as well as that I'm doing specifically the nutritional interventions for them. So with that case, that especially with this background, with this involvement of the Global Recharge Project, I was got real exposure to the lot of research conferences and the research experiences in whole world. Actually, if I said it as all world, it's correct, because the Global Recharge Project is something that which is involving with the most of the countries, low and middle income countries in the world. So in that case, we are having a lot of partnerships. So in there that you can see that how we have gathered and how we have done this work, like how we have shared our ideas, same time that we were able to do our expose ourselves to the lot of conferences, like the international conferences like ERS and IPCRG, as well as that in there that we have got lot of research experience actually, because as a very new nurse researcher is a very new concept for Sri Lanka. So that it's kind of the nurse researchers are not much common concept in our country, but as a very beginners in this field. So we are really lucky to have this exposure with the Global Recharge team. So it was really help to the development of the research background as well as the nurse researcher concept in Sri Lanka. So with this all background, we are sharing our experiences and we are sharing our the knowledge with our nurses. So for improve their knowledge as well as improve their research background, because which will be really important for the development of the profession. So thank you very, I'm really appreciating and thanking for this Nurses Now Challenge for giving this real opportunity to share our experiences which we are having with the Global Recharge Project as well as this rehabilitation research. Thank you.
Thank you so much, Camila. And really great to be able to hear about your experiences as a researcher. And looking forward to be able to getting some questions coming through the Q&A box. If you want to be able to ask Camila any questions. Our next speaker is Akila Jayamaha, also from Katsu International University in Sri Lanka.
Hello, everyone. Good afternoon, good morning. I'm Akila Jayamaha, nursing lecturer at Katsu International University of Sri Lanka and a research lead at Global Recharge Sri Lanka, and also PhD candidate at University of Leicester. It is a pleasure to share my experience as a nurse educator involved in rehabilitation research. I have completed my bachelor's degree in 2014. Then I worked as a nursing officer few years with the hope of becoming a nurse educator. I wanted to continue my education further. So those days we didn't have in Sri Lanka, we didn't have any master's degree related to nursing. So I enrolled and completed master's degree in applied epidemiology. Then I joined Katsu International University, Sri Lanka as a lecturer at Department of Nursing in 2017. So KIO is one of the leading universities which award a bachelor's degree to the nursing officers. So I could help more than 2,000 nurses to fulfill their dream of becoming a graduate nurse since 2017. After a few years, I searched PhD opportunities and I met Professor Savitri, who is the principal investigator of the Global Recharge Sri Lanka, and she invited me to join the project. It was the life-changing milestone in my career as a premature researcher. The ultimate, so in Sri Lanka, COPD prevalence is really high, but very limited PR programs or pulmonary rehabilitation programs existing, and it is not embedded in the Sri Lankan healthcare system as well. So with the Global Recharge, we could able to restore the health of people with lung diseases through development of effective pulmonary rehabilitation programs in Sri Lanka. So I'm really fortunate enough to obtain position at University of Leicester in order to undertake a distance learning PhD as a part of research training with the Global Recharge Project, NIHR, in 2020. And also it is a prestige being supervised by Professor Sally, Mark, and Professor Savitri, who are very experts in pulmonary rehabilitation. So as a nursing graduate, I had very limited exposure to the research, but I'm joined Global Recharge project and participating research training provided by University of Leicester. I managed to improve necessary skills and the knowledge that I want to continue my education and also research. As a nurse educated in Sri Lanka, I have faced a lot of challenges while doing research, and I received huge help from my research colleagues in University of Leicester as well as Global Recharge Project. So I like to wind up my talk with the good saying of challenges are what make the life interesting, but overcoming them is make life meaningful. Thank you very much. Thank you very much for giving this opportunity.
Thank you so much, Akila. really great to be able to hear your story as well, and be able to hear your experiences as a nursing researcher. And to our audience, if you've got any questions for Akila, if you can be able to post them up in the Q&A box, and we'll be able to get to them in the session just coming after this. Our next speaker is Aidai Timarel Kizi from the National Center for Cardiology and Internal Medicine in Craigston.
Hello, dear colleagues. Allow me to present my first experience as a nurse, a pulmonary rehabilitation study. The aim is to recruit all nurses in Congo's Republic to participation and nurses in such kind of science project. Nurse in research work. The most important task of nursing is to achieve the highest efficiency and quality of nursing care for the population, to implement these complex tasks to improve the professional and social status of nursing. It is necessary to create a scientific knowledge base that forms the basis of professional nursing practice. Nursing research work. Nurses in scientific research are one of the new areas development is professional field. The analysis of forest experience confirms the quality of change on the system of providing medical care to the population in connection with the introduction of the result of nursing research into the practice of medical institutions. The development of research on nursing is associated in most countries with the academic training of nurses. Global research project research. Pulmonary rehabilitation is a non-drug, inexpensive, highly effective interest that eliminates the disability associated with chronic respiratory disease through patients' addition and exercise. It brings together healthy professionals of many disciplines, offers healthy exercise and training in chronic respiratory disease. The project is aimed at creating cultural adaptation and acceptable care program and proving its effectiveness. Research objective. Cultural adaptation of peer, including music, singing, and dancing, the sport of peer exercise for patients. Developing a referral strategy for peer to assess the effect of peer on walking distance and quality of life patient with post-tuberculosis change in the lungs. Investigate a difference in patient response on the end of the peer program. First, in experts of research nurse in the rehabilitation of post-tuberculosis pulmonary patients. With the skills to conduct spirometry, 60 minutes walk test, shuttle walk test, nurses can be full-fledged researchers in scientific projects. We have adapted the peer program for the local conditions in Congo's Republic and successfully finished first peer trial. Methods of pulmonary rehabilitation have been tested on ourselves. Dancing for health benefits. In addition, we add for peer program dancing, rhythmic movements, individual approach, games with ball for patients with post-tubercular lung disease. We were very glad to see how patients recovered and feel themselves happy. Thank you for the attention.
Thank you so much, Aidai. And really great to be able to hear your experiences with pulmonary rehabilitation research. And it's amazing to be able to have you on with us on the platform today. Looking forward to being able to get any questions that our audience may have to be able to share with you. And those are our panelists for this session. Mark, it's really amazing in terms of the experiences that we've been able to hear and that have been shared this afternoon with nurses that are key and engaging within research.
Yeah, no, it's been wonderful, and as we wait for questions to come in, please don't be shy. We can start maybe with Chamelia, just to start things off. What have you enjoyed most about being involved in research?
Yeah, actually, it's kind of a really nice experience because the every time researchers give some question, and we are the answer finders for these questions. So as nurses, one thing is in there that every time people who are coming to us, they have a question, so they have a problem. So that like they are looking some answer from us for their question. So like so anyone who when someone got sick, so they are really becoming helpless, even that they are really rich people, they are really wealthy people, that still they are getting really helpless, so they are looking some help from us, so as the healthcare providers, especially as the nurses. Therefore that the if we can if we can say something to them, if we can give some relief to them, so that's a very good thing, and that's a very help to them. So by the research, at every time that we are finding some solution for them, solution for these problems, which is existing problems. So like it's really nice experience to give some relief from our findings. If someone getting some relief from our findings, especially that our pulmonary rehabilitation, it gives the like a long-term therapy or long-term relief for this person, for people who are suffering from the disease. So that is the really enjoying thing in me to doing the research, because like as that is what the people looking from us as the nurses, as the healthcare workers. So that is the most enjoyable thing to me, to give these solutions and making some relief on the suffering of the people in this specific areas.
Wow, that's amazing. Thank you so much, Camila. And I think that brings us to possibly my next question in terms of what are some of the challenges that you have experienced and how have you overcome that?
Yeah, actually, the most the one of the problem that we are facing is that the one thing is resources that which is available for us. So because that anyhow we are initiating new thing, that problem comes because that when we are allocating the resources, the special human resources and the material wise, that we are having problem. As well as that, that is one thing. Another thing that especially in related to my area, that I'm really experiencing the problem as people's beliefs. So it's very hard to change the people's beliefs, especially like if I take an experience for the nutrition wise. So if I am telling them to eat something, but for especially for the pulmonary rehabilitation, so the COPD patients, if I have said something to eat for them, but if they have experience or if they have a myth that this may be causing some problems with their disease, so it might be their own problem, not with the specific for their disease, but this myths made by the society, made by someone else, they are really believing on that rather than the things that we are telling. So it's very difficult to change the people's myths and the beliefs when they have embedded on that. So it's kind of a very big problem, especially the country like us, because we are having a very strong cultural beliefs and cultural expectations. So it's very hard to change their beliefs. So that is why specifically that we have find out this area, cultural adaptation for this program, because if we haven't addressed the culture, people won't accept us. People won't accept our solutions. So it need to be go with their culture and their beliefs. Otherwise, they won't be accept us. So that is another kind of a challenge that we are facing, specifically introducing these new things relating to this disease conditions and everything.
Thanks, Jamelia.
Wow, thank you.
Sorry, Minashi.
Yeah, sure. That's okay, Mark. You can go ahead.
Thanks, Jamelia. I see in the Q&A, I think we have a question for Akila. This question is coming from St. Joseph in the DRC. How would you see the cooperation being facilitated with their nursing institute? So they're looking, I think, for some advice on, I guess, how to set up, more opportunities for nurses at their institute to get involved in research. You've given a nice overview of, your lecturing position. What advice do you have for them wanting to do something similar? You're on mute.
Sorry for that. So actually, in our degree program, we make the research mandatory. So the nurses should follow the research course, research module, and they have to engage in a group research, not an individual research. They have to go to a group research. So there they can get their skills and necessary things and knowledge and skills that they need to continue with their research. So that will be a motivation for them to continue and start their career as nursing research. But in Sri Lanka, we don't have that specifications as nurse researchers. So they are doing research as while they are doing their own practices as well. So that is the way of as a university that we are following that. So we mandated the module. So.
Thanks, Akila. I think one of the key ways in, isn't it, is to sort of infiltrate curricula and start to embed research within that, and similarly for rehabilitation as well. Thank you. Minashi, do you want to carry on?
Yep, sure. And really just appreciating that as well, in that I would imagine it's quite a process in being able to get it actually adopted into curricula. And it's something that's it takes time and requires quite a lot of persistence and patience. So yeah, just appreciating that discussion. And possibly I'd just like to ask Idai, what advice would you give to nurses thinking about getting involved in research?
I will advise nurses who want to participate in scientific research that you should not be afraid, and despite all the obstacles, to move forward.
Perfect. Thank you so much.
Great. We have there was just another question in the Q&A about joining the Pulmonary Rehabilitation Research Network. I think what we can do is, following on from the webinar, share contact details, I think, if that's okay, and the speakers who are happy to do that, I think, can do the same. Is that right, Minashi?
Yeah. Perfect.
So
that sounds good.
Brilliant. So we'll follow on with those details. Maloney, thanks for your question. And also thanks to Magnus, who sends a nice message in about really wanting to engage in nursing research. So it's really nice to see these messages, and there are lots more in the chat as well. So please keep questions and comments coming in. Perhaps we can go more floor open. So any of the speakers who want to answer this question, and it kind of comes back to the sort of what advice you would give. So I don't know, Chamilia, maybe we can come back to you. What advice would you give people, give nurses who want to get into research? What's the, from your experience, what is the sort of one thing that you would really recommend?
Yeah, my first recommendation is that, Mark, continue your education. That is the most important thing, because I'm not seeing it in the most Western countries, but when it comes to the most of the low and middle income countries like us, so the most of the nurses are stagnated in some places. Just when they have reached to some level, they are stagnated, and they are not going beyond that. Their routine work comes up, because like one thing is that most of the nurses are females actually. So like, this is not any kind of any discrimination, but when it comes to the female nurses actually, so when they come to some level, so they are getting their family life, like, so I'm telling this to my students even, because when they are coming to these studies, so they are life like a vehicle with a three-wheeler. So first wheel is that their personal life, second wheel is that their profession, because profession is also a really big responsibility. Their 1 second mistake will make someone else's life threatening condition. So the new wheel is that their education. So they have to balance these all three wheels to go on their journey. So that is the most important thing. So they have to balance this everything. So this high education, continuing education, and the adult education. So this, like, if someone can balance these three things and go on this journey, so it will make a really effect on their life as well as for our profession. So they have to make their own, they make their own the like life, their own development, to make the development of the profession, because otherwise that we cannot build up our profession or the nursing, like nursing career. So that is the most important thing, as I see. That is the message that I need to give for the nurses. Whole nurses, continue your education. There is no end to the education, because it will give the real output for the whole world. So that is what I want to say for the whole nurses in the whole world.
Thank you so much, Camila. And I think that's a very strong message. You touched on a lot of big points there on balance and striking that balance, which actually gets me thinking about with a lot of nurses as well, like being clinical, how to also strike that balance in clinical and being involved in research. So yeah, I think you bring up a lot of key points there. Anika, would you like to also answer the same question, or?
Yeah, I think when it comes to nurses, we do a lot of research, but we don't use those findings for our day-to-day practices. So that is a very good, I need to emphasize that if you found something, try to involve it into the practices. So we have a lot of problems while we are working, and while we are caring the patients, we come across a lot of problems, and we can do research, we can conduct some research, but don't waste those findings or just confront it for only for the publication. But if you can use those findings for changing your professional career, not only and also practices, so that will really helpful.
Sure. Thank you so much, Erika. And really, I feel we've had such a strong discussion so far. So it's I feel really sad to be able to get to closing this session. But possibly just to close this Q&A session, we've got a question that has come in. And the question is, how do nurses enter into research? It's a question that has come from, let me just check. Sorry about that. Let me just check for you. Mercy Opara. So would any of our panelists want to answer that question? How can a nurse enter into research?
So, as my opinion, I think nurses can enter into the research by follow some kind of formal some kind of courses with regards to research. So when they have necessary skills and knowledge, of course, they can continue with the research. Of course, without the proper knowledge, of course, you cannot conduct this research. So you start with the course and get some necessary skills or knowledge to conduct the research.
Sure.
As well as that, I need to add something to that. Observe your environment, observe your problems, which you are having, which you are facing in your surrounding, because like that is gives you the idea to research. None other else, like the research problems are not comes with any other planet. It is there with you. So as the nurse, the things which you will be experiencing, it will be your research problem. So for that, you are the person who can give the suggestions for that. So from that, you can do the research, you can give the findings, you can give a solution. That is the main theme in the research.
Sure. Thank you so much. And thank you to our panelists who've been able to share with us this afternoon. We're still going on. The webinar is still going on. We've got another jam-packed session that is following on after this. We're just going to take a short break right now. We're just going to take a 10-minute break. And then after 10 minutes, we're going to come back with our next speaker. And we're just going to have continue the session. And it's just going to be another jam-packed session. So thank you so much. And looking forward to seeing you in the next 10 minutes. Hi, everyone, and welcome back again. And we hope you've managed to grab a coffee or grab some drink or some juice as we begin on and continue on with this amazing session. And now we move on to the second part of this session. And we've got a presentation that will be coming from Michelle Bourne. Michelle is a senior research nurse and a lecturer with the Biomedical Research Center for Respiratory. And she will be sharing on a journey of 1,000 miles begins with a single step. Welcome, Michelle.
Thank you. So the title of this talk is "A Journey of 1,000 Miles Begins with a Single Step." And it's been great to hear everybody's different pathways and how they are making their journey within research. And I just wanted to share with you today, we have been active in research, in respiratory research in Leicester for the last 25 years, and just share with you some of our experiences and how the nursing research role has evolved during that time. So 25 years ago, we had a minimal activity going on here in Leicester. This was our little office space. We had one research nurse and we had probably 2 or 3 clinical trials running during that time. And this was our clinical area where we were able to see patients. It was a time that things started to change within Leicestershire and services started to be rebalanced and moved into the various hospital spaces. And Glenfield General Hospital, where I work, became a respiratory specialist centre. So at that time, they appointed 3 respiratory consultants, and that was really the catalyst for change in Leicestershire. And these 3 respiratory consultants became our principal investigators and helped to start and lead our research process. So one of these was a lady called Ruth Green, who did the first academic research study that was done here in Leicestershire. And to this day, she's still the most cited person for that work that was done in eosinophilic asthma. So then we move on to around 2012, and this was a huge year when the national infrastructure changed and it gave centres the opportunity to apply for funding. We were very lucky in Leicester, and our application we were awarded and we became a biomedical research unit. And with this brought many things. So the first was the opportunity to develop our staffing. So the picture here shows the complete team which is now in place. So this has happened over a long period of time. But I think the thing that I wanted to say, yes, we do have research nurses, but our research is very much a multidisciplinary approach. So we have developed roles in research assistants, we have data managers, we have the governance team who help with our ethics submissions, we have physiotherapists, scientists, and it takes the whole team to make research happen. The other thing that it brought was the infrastructure, and we are very fortunate to have this amazing building. On the ground floor, we now have 10 clinical rooms, which can now support, we have up to 50 studies running at the moment, so we've developed that much during this time. On the middle floor, we have office space, which as a research nurse, you do need to be able to use half of your time at least to be able to make the research happen. And also on the top floor, we have our lab staff, which is great because we can samples can be processed on site. So in terms of our research development, so all of this infrastructure has helped us to develop, and we have now been able to offer higher impact papers and journals, and these are both and also collaborations with other institutions, and these are both locally, so within different specialist group, and nationally and globally, and also collaborations within the hospital and other members of the multidisciplinary team. So pharmaceutical companies are now very happy to come and work with us. We are very attractive to pharmaceutical companies because our professors work very closely. We are approached with different compounds, which our professors and our nursing staff are also involved in helping to see how we can implement that and the research on the ground level. The clinical skill development, I feel like research has developed a lot over the 25 years. Back in the day, it would be that the doctor would write a protocol and the nurse would deliver what was on the protocol. There's been a lot of change in that area as nurses have become more skilled, and we help to write the protocols. We work alongside the professors who value our opinion in helping to sort of implement that on the ground level. We also have single centre studies which we have now been able to develop.
Clash of them.
Sorry, if you're just tuning in, may you please mute your microphone.
nanti gumini siya ibunis ng channel na da voice message ay voice on ten 진짜 wala daw daw ay jang sila ay kamo
Hannah, is it possible to try and mute the microphone?
Yeah, I'm trying. I can't seem to do it, but I'm working on it for sure. Sorry, everyone. Damian, can you hear us? I think you've come in and you're not on mute. Can you mute yourself, please? Bear with us, everyone. So sorry, Michelle.
Okay.
Sorry, Michelle.
There we go.
So the changes in the research nurse role. So as I said, we've changed from having a protocol and delivering what was on it to being involved closely with the setup of that. We also help with writing protocols, and our opinion is valued by the professors who are leading here at Leicester. And I think they have seen the nursing role evolve from somebody who was probably happy to pick up a protocol to somebody more independent and would like to be, you know, we are very much at the heart of everything going on here in Leicester in research. And there was some talk earlier about how sort of people have juggled and found their way into research nursing. And I've been doing this role for 16 years now. And it's been amazing for me to be able to continue to build my career alongside having a family. It's enabled me to be adaptable with my working hours to allow me to be a mum of 4 and also continue to develop my career. And I've also sort of managed to, I've been promoted during that time to the senior nurse. So other ways in which the nursing roles changes, we're very much patient and public and community engagement responsive. So we are out there at different events. We tell anybody that we can about what research we're doing. Any kind of support groups like Asthma UK, Breathe Easy groups, we're very happy to sort of go in and talk to people about what's going on. We have a recruitment database where we recruit patients onto our database who want to be involved in research. So research quickly influencing clinical practice, and that's something that has changed the speed at which treatments, and I think the pandemic has been a great example of that, where nurses have recruited to the recovery study, they've been responsive, recruited huge numbers of patients, and been able to offer treatments that have saved many lives due to nurses being so responsive within that area. Again, I'd mentioned about having the opportunity to write protocols and be involved in that and give their opinions to building a solid protocol. And also encouraged to present our own research. Here's myself at the bottom and my colleague Sarah at a European respiratory conference. So we're continuously striving to raise the research profile, and I think that's one of the challenges. Very often a general nurse, and I've had this many times over the years, they'll pick up a job description of a research nurse and think that they can't do that. There's something in there that's very complicated. There's something that they can't learn. And you know, that's something that I like to break down those barriers all the time and give people opportunities within our trust to come and take part, come and shadow, come and look and see what we're doing. The teamwork between the clinical and the research staff is something that's grown massively, and we are now embedded into clinical wards and patient outpatient clinics. And I think this has been central to, first of all, the pandemic and the research that's happening there, but also in the future, we are trying to recruit patients acutely on acute respiratory wards, as well as working with outpatients for the specialist research. And the future challenges will continue to be, one of the challenges will be to continue to embed within the clinical areas. At the moment, everybody sort of is very research, they're open to more research than they ever have been because of our impact throughout the pandemic. And I think it would be great if we can continue to build on that, and we're embedded as we should be, and continue to grow and develop our profile, both locally, nationally and globally. Thank you very much.
Thank you so much, Michelle. And really great to be able to hear your presentation this afternoon. And I think, as you put it, the journey really begins with the first step. I think for many nurses, looking at research, it can seem intimidating initially, but really it's about just going at it and making that first step, as you say, and really getting into it. So it's really about, and it's really encouraging to be able to hear from you this afternoon, and really great to be able to hear about with the research unit, the biomedical research unit, and the development with that as well, and from where it began. So great to be able to hear from you this afternoon. Thank you. And from here, we'll move on to our next part of the session. And we're going to have a panel with global nurses on engaging in research to improve quality of care and patient outcomes. For the panel discussion, we're going to start off with a video from one of our global nurses coming from the Philippines, Lloyd.
Hi, my name is Lloyd Nunag. I am a Filipino research nurse. Thank you for the opportunity to share my perspective on this panel. First of all, I think it is important that when we talk about nurses, we need to go beyond their traditional roles. Nurses are on the front lines, but they are also advancing health and safety as researchers, advocates, and leaders. It is essential that nurses are engaged in research to improve quality of care and patient outcomes. And there has never been a better time to work in research than today. The pandemic era has emphasized that nurses in research can make communities and countries healthier and stronger. We can bridge the gap in clinical knowledge and excellent patient care through nursing research. However, despite our invaluable insights, nurses don't play enough of a role in research and decision making. Even though we provide essential health services and are key to achieving health for all. Let's change that. As the health professionals closest to the public, we should be empowered to use our knowledge, skills, and expertise to the full. We will help turn the promise of universal health care into a reality. We need strong public health nursing research presence today, during COVID-19, and long after. Why is this important? It is extremely important because nurses are the key to service delivery in most health settings. In primary care in most of the Philippines where I've worked before, they only have nurses delivering primary health care, and yet their roles and their voices are severely undervalued. Nurses comprise the majority of healthcare workforce and are in closest proximity to problems patients face and are well positioned to create, deliver, and implement solutions. Yet, nurses do not routinely participate in research and developing solutions, often are not recognized for their contributions, and are disproportionately underrepresented within healthcare innovation. Nurses and midwives can bridge the divide between research and improve quality of care. They should be respected for the pivotal role at the heart of most health teams and healthcare innovations. Nurses, as researchers, leaders, implementers, will turn the ambition of achieving health for all into a reality. I am hoping that the Nursing Now campaign gets nurses recognized as the leaders of healthcare innovation that they are, and helps them find their voices in ways they often don't. Thank you so much.
Thank you so much to Lloyd for sending through that video to us. Unfortunately, Lloyd couldn't be with us for the webinar this afternoon, but really great to be able to have him send through that video. And just from the video, you can be able to see the passion that he has, and really what we're trying to share on how rewarding it can be to get into research and be a nurse in research. Our next panelist for this session is Jamayang, who's joining us from Bhutan. Jamayang, great to have you on the call with us. Jamayang, can you hear me? Oh, I think you may be having trouble with connection there. I'll move on to our next speaker. We've got Ariani, a young challenger who's joining us from Indonesia. Welcome, Ariani.
Hello, Munashe. Okay, so hello, my name is Ariani Pertiwi. I'm a nurse from Indonesia. Right now, I'm a faculty member at Gajah Mada University, one of public universities in Indonesia. So about the research, I absolutely agree with what our speakers at the first session and then the current session. said, and especially Rancha said that nurses is the biggest number among healthcare professionals. So for sure, nurses can have a big influence in the health system. And I think all of us have the same understanding on this, that research is very important in our field, right? But I would like to share you a phenomenon, actually, at least in my setting in Indonesia. Well, there are still a small number compared to the whole number of nurses in Indonesia who are familiar with research. Well, I am fortunate that I took my nursing degree in one of the best universities in the country, which I know research, learn about research method. And I took my nursing degree in, and I got opportunity to continue my study to doctorate level in the US. So I'm exposed to a lot to research culture in the hospital. Like our keynote speaker mentioned, that research is not easy and not cheap. So research in my country mostly lead by the one who are in the academic institution. Well, we know that in a clinical setting, we do really need research to improve the quality of care and patient safety for sure. But unfortunately, the awareness of the importance of evidence-based practice is not yet there, or, well, I would say still low. One problem, in my opinion, is lack of knowledge about research methodology, because like maybe Camila said, Camila said, most nurses stuck in their routine and not think critically anymore. So continuous study is one of the strategy, but unfortunately, again, not everyone can do that. And another problem, I think, funding is one of the problem to conduct the research. Not everyone can easily get the funds to conduct the research. But in Indonesia, hopefully we are moving forward to that research culture, hopefully. For the last 2 years, our government regulation have nurses in level 3, because we have 5 levels for career ladder for clinical nurses, is mandated to have research project when they want to propose a promotion. So hospitals now in big cities especially start to give funds for nursing research. So research unit inside the hospital is start to grow. So like Michelle just a while ago mentioned, hopefully this journey began with the first step, this small step with the government regulation, and also for sure the research method embedded in the curriculum in the undergraduate nursing level. Thank you, Munashe.
Sure. Thank you so much, Ariane, for that. And I think you put it perfectly. There really is a challenge in terms of being able to get colleagues and nurses to value the importance of evidence-based practice. There's a statement that's always said sometimes whenever you're working clinically, that if it's working, why change it? But I feel that's something that we really have to address, in that, you know, there's always a way to be able to improve care and to be able to improve management. So yeah, that's really amazing in terms of you being able to share with us this afternoon. And just putting it to our audience, if you've got any questions that you would want to share with any of our panelists this afternoon, if you can be able to put it through in the Q&A box, and let us know your thoughts, what your thoughts are. You can be able to also highlight in the comment section if you've got any comments on the discussion we're having this afternoon, on what are some of the challenges and the barriers you feel there are in being able to get more nurses into research. Mark, would you want to take us through the Q&As?
Yes, so thank you very much. So I think that there's been some really powerful messages here, and I want to perhaps just take you back slightly to Michelle's talk. Michelle, you showed a really lovely picture of the big team that you have at the BRU, and emphasised the multidisciplinary aspect. And I think that is really important to remember, that it isn't just about a single profession. And yes, of course, we need clearly to emphasise the importance and the roles that nurses can play, but it's also about not forgetting it is always going to be a team effort requiring multiple expertise. So can you maybe speak a little bit more about the team in Leicester, and maybe your experiences of how that multidisciplinary team came together, and how it kind of works, how it functions?
Yeah, so obviously with infrastructure came money, and we were able to look at all the different roles that potentially we could have and develop. We're very, very lucky to have what we have here in Leicester, and I'm sort of gathering we're quite unique, and a lot of my colleagues sort of in different countries have different experiences. So by multidisciplinary, we could mean, for example, we share a building with the exercise team. So it could be that it's physios, it could be we've got physiologists, we have doctors, we have data managers and ethics and governance team. So it's a bit of a jigsaw really, and everybody plays their role. We've also developed research assistants, which aren't nurses, which by background, these are healthcare assistants. They are paid at a lower band, but are amazing support for those people that are delivering research, and you're able to use your skill mix better by using a multidisciplinary approach, so that everybody does what they do best. So for example, as a nurse, I can do nursing duties, whereas I might have a data person to enter the data, which can take a lot of time, so I can be more productive in my role as a research nurse.
That's great, Michelle, thank you. And I think it's it is about raising people around you as well whilst you're on these journeys. I think it's really important. Ariane, if I could ask a little bit about you described the a really excellent idea of how research has been integrated into the sort of promotion journey of nurses. Could you perhaps just maybe give us examples of some of the research ideas or some of the research projects that have been conducted as part of that process?
Yeah, thank you, Mark. So, well, I personally really grateful on that government regulation that our nurses should have a research project when they propose a promotion. So it is force our nurses in a hospital to really learn about research method. And by that time, I am already here in the university. So they call me to, share my knowledge about research method. And I say to them that, well, your research question is actually around you. So for example, I gave them an idea to how would you treat your patient with this wound? Would you like to use this kind of treatment or another medicine to conventional, traditional, or complementary care? So those kind of things, actually, we have a lot of questions, but most of us not really aware that we can answer that question through research. So increasing that awareness is just the thing, I think the first step that Michelle mentioned. And Mark, if I may, actually, I was going to give Michelle a question. Okay, all right. Yeah, about the following up your question about multidisciplinary research. So, Michelle, for us young nurses to step in to that multidisciplinary research team could be, kind of challenging or maybe even scary. So do you have any suggestion for young nurses to step into that multidisciplinary research team?
I would hope that a young nurse coming into a multidisciplinary team would feel safe and in a good environment to be able to learn from everybody within the team, as you're all there for the common purpose, really. Certainly nurses coming into my unit, I would definitely give them a mentor on site and help them to sort of grow in that way by offering appraisal and looking at problems, and hopefully sort of by offering them the buddy system that they would talk about any issues that they're having, so that it wasn't a scary experience. As research can be learned, nurses have already shown that they have got the skills to be able to study at that level, and I think they just need to be given the support to be able to carry on and grow their research interest.
Thank you.
That's great. Oh, sorry.
Sure. I was just going to say that's amazing, Michelle. And I think you touch on a very important aspect of that mentorship system in being able to have young nurses being brought into it and groomed into it, groomed into research. And I think that's a big challenge that is there, possibly globally, in terms of what is required. What does it take to be able to groom and encourage more young nurses to get into research?
Great. There's a question in the Q&A, Michelle. There's no rest for you. It's similar to Ariane's, but slightly broader in terms of what advice would you give to a nurse who is new to research? It's quite a broad question.
So a nurse new to research, I would hope that they will be given some kind of mentor in practice. And if they haven't, then find a mentor. It doesn't matter if they are not a research specialist within your area, but somebody who you can relate to and talk to, who can be a mentor to you. Not necessarily sort of in your own area, it can be within any area to give you that sort of support and guidance. Hopefully you'll have an appraisal where you'll identify your needs and be able to sort of continue to grow in that way with the support, but definitely find yourself a mentor.
That's great, thanks, Michelle. And there's a comment also from Basma in Egypt, who raises something that's been touched on numerous times about funding and financial problems being a big barrier. I wondered if any of the speakers want to comment on that. I know that, looping back to Arantxa, your excellent opportunities for people in terms of the pump priming and attending the qualitative course. I don't know whether you want to comment maybe a little bit on this.
Thank you. I know funding is one of the big issues. For us, this is the first time that we've been able to offer some funding. We would like to keep doing it in the future. One of the things that we've got to help maybe people trying to look into funding, we've got some resources in the hub to look into that. Yeah, funding is an issue. Maybe another way to look into that is creating collaborations within other units around where you are to try to maybe either learn from them if they've managed to get some funding, how they've gone about, or to get together a few people to make a stronger application. Maybe those are solutions. For us, it's very important and interesting to understand what the challenges for nurses are to get involved in research, because this is the way we want to be able to offer resources to be able to overcome these challenges. So yeah, any kind of challenges, if you would like to get in touch later after the webinar, for us is very good, because it will get us thinking about how we can support nurses all over the world to bring research. And as it's been said before, looking into what is around you, finding the problems, because research is not just there to publish paper, but it's to find solutions to make care better, make things better. So even you can get involved by small things and then grow from there into bigger things, if that's what you wish. But little things can more easily be incorporated within clinical care. Yeah, sorry, I don't have an endless pocket of money. I would like that, but we could maybe try to find a way to support nurses with funding, definitely.
Thank you so much, Rancha. Really great to be able to have you be able to highlight the resources that are available, and how it's important that for us as nurses also to look locally as well in terms of what opportunities there are there to be able to drive our research as well. So that's really amazing. I'd just like to go through the chat box as we get ready to wrap up. We've got a comment that has come from Ida. I'll just go through the comment. So Ida says, I know the work of nursing in my country, Brazil, and from some other countries, Colombia, Mexico, Peru, Singapore, Spain, Portugal, and Canada. In my experience for 30 years as a nurse, teacher, and researcher, I consider that nurses are still focused on doing with knowledge produced in universities, but they have difficulties in developing research in their work environments because health institutions require them to develop their care and management, sometimes educational activities too. But nurses are not able to devote time to research. Institutions do not value research, only the knowledge that is already done. Despite this, we have already advanced a lot, especially in universities, but we still have a lot to advance. Yeah. Thank you so much for that comment, that amazing comment. Any of our panelists would like to comment on that or share on that?
Oh, yeah, Munasha, if I may jump in.
Yeah, sure, Ariane.
That is really true. I absolutely agree what Ida said, that as I mentioned a while ago, nurses in the clinical settings is mandated. It's like they run out of time to do the care, but not the research. So like, well, at least I can say just in my setting that it needs more effort for nurses to really think about nurses. And so I think the managers, the administrators, if they really want to improve the care, the quality of care, they need to, support the nurses by maybe make a research unit or those kind of things. Because yes, what Ida said is just similar to what I experience here. So I absolutely agree with her. Thank you, Munashe.
Sure, thank you so much, Ariane. And I totally agree that institutions do need to devote time and give nurses the time to be able to do research and also the opportunities as well. So I think it's a big topic and possibly a topic for a whole nother webinar in itself. But really just to thank all our panelists and all our speakers this afternoon. It has really been great. We've really had a really strong session, and I hope we have encouraged any nurses that are on this call to get into research and to be involved and to start thinking about what is in your local environment and what questions you would like to address and how to be able to use research and be able to answer those questions and find solutions. Thank you so much for joining us this afternoon to our audience. We look forward to always having you as part of our webinars and our webinar series. If you can log on to our website, the Nursing Now Challenge website, and just find out more about our webinars that are coming and challenges that we have as well with the Nursing Now Global Solutions Initiative. And really thankful to be able to have you here this afternoon. Just to run through stats, I think currently we've got 160 participants from all over the world. And there was a point during the call, I think we reached around 260. So yeah, that's really amazing that we got so many people joining us this afternoon. So thank you so much, everyone, and have a good rest of your day.
Thank you. Bye-bye.
Thank you. Bye-bye.